Hi, I'm Lieutenant Colonel Scott Gregg. I'm a physical therapist assigned to the Office of the Surgeon General, and I'm also the activity lead for the Performance Triad. And from an activity perspective, we have two big concerns. One is musculoskeletal injuries that our soldiers suffer due to ineffective training, and two, poor health of many of our beneficiaries due to sedentary lifestyles. So let's start out by revisiting Army soldiers and Army families. A big branding strategy for the Performance Triad is that Army and Army families are an unstoppable force on the battlefield and at home. We know that soldiers do great things to defend the nation, and we also know that families do great things supporting soldiers. However, with the advancement of technology, we tend to spend more time sitting instead of moving, eating fast rather than nutritious foods, and replacing screen time with sleep time. A vast majority of our beneficiaries get too little exercise and too little activity. And as I mentioned earlier, our soldiers get injured too often. Injuries are the #1 reason that soldiers seek health care, and a vast majority of these injuries are musculoskeletal in nature. In fact, in 2012, there were 3.7 million active duty military medical visits and hospitalizations for neuromusculoskeletal conditions. Musculoskeletal injuries account for 11 million limited duty days annually, and 80% of these are due to overuse. And because they're due to overuse, they should be largely preventable. And what we're seeking to do with the Performance Triad is to empower leaders and soldiers to avoid injuries by making better training decisions. Besides injuries, the other concern is the lack of everyday activity. The average American is sedentary, getting only about 5,000 steps per day, as opposed to the 10,000 recommended. And the average American tends to sit about 8 hours per day. We know from research that sedentary behavior has been linked to obesity, diabetes, cardiovascular disease, cancer, and even death. Now, exercise and activity are proven treatments for things like metabolic syndrome, hypertension, chronic muscle pain, and also many behavioral health concerns, such as depression, anxiety, ADHD, and stress. A great book to read on the cognitive benefits of exercise and activity is this book, Spark. We'll be giving this to you in a reading list, and I'd recommend that you pick it up if you get the chance. Now, the Performance Triad is an Army program. It's not just a MedCom program. What we seek to do is empower leaders to take more responsibility for soldier health. But we need the same messaging coming from the MTFs to soldiers, and we need family members bringing the same message home from the MTF to soldiers. We need the healthcare team to nudge patients, so to speak, to get more exercise and activity in order to lessen the prevalence of chronic illness. Another great book to read is the book Nudge. This talks about choice architecture and how we can get our patients to make better choices about the health decisions they make. Now, we can't affect all that goes on in the life space, but we need the MTF healthcare teams on message, reinforcing messages delivered by the Performance Triad, Comprehensive Soldier and Family Fitness, Healthy Base Initiative, and other programs. And it's not only our patients who suffer from a lack of activity, sleep, and proper nutrition. Healthcare providers have the same issues. A study in 2013 showed that 90% of emergency medicine residents, despite how active they are, did not meet the 10,000-step goal for a 12-hour shift. Another study in 2012 showed that only about half of medical residents and medical students reached their 10,000 daily step goal. So how about overweight and obesity numbers? A study in 2008 showed that 54% of healthcare providers reported being overweight or obese, and half of those reported they lacked the motivation to make a lifestyle change. We really need to reflect on our own activity levels and model health to our patients. Would you go to a mechanic who can't fix his car? Would you go to an accountant who can't balance his or her checkbook? We need to take our own health seriously if we're going to tell our patients to take health seriously. So here's what I'd like to cover today. Tools for assessing exercise and activity levels, how to prescribe exercise and activity for good health, resources both for you and your patients, and finally, when to refer to a specialist. So let's start with tools for assessing exercise levels. When we screen for exercise levels, there are two primary concerns, either too little exercise, which is most family members and retirees, or occasionally too much, which is some of our soldiers. Now, the T-SWIFT AIM form allows you to screen for minimum exercise levels. It has a screening question that reads, does patient do moderate exercise for 30 minutes most days of the week? So it's pretty easy to screen for the minimum levels. Now, for those who are getting too much exercise, you rely on your clinical exam, and this is specifically with soldiers. So we're looking for symptoms of overuse like joint pain, muscle soreness, or potentially overtraining symptoms such as insomnia, change in appetite, irritability, anxiousness, loss of weight, loss of motivation, inability to concentrate, depression, or even changes in resting heart rate or blood pressure. Now, if you have a patient who's new to exercise, consider using the PAR-Q to see if he or she is ready to start an exercise program. Now, exercise screening is important, but what about non-exercise activity? Emerging evidence points to the importance of everyday activity to prevent chronic diseases. In fact, everyday activity may be even more important than exercise. Think about it. If you're only doing 30 minutes of exercise per day, what about the other 15 and a half waking hours? Now, a great video to look at on this is from Rock Center, where they interviewed Dr. Levine from the Mayo Clinic, and he talks about the benefits of regular activity on an everyday basis. And when screening for activity, there's no T-Swift aim form question to cue you. So what you're going to have to do is ask, how much time do you usually spend sitting or reclining on a typical day? Now let's talk about what healthy exercise and everyday activity you can prescribe to your patients or nudge them to consider. What we want you to do is prescribe exercise as medicine for metabolic syndrome, hypertension, chronic pain, depression, anxiety, stress. Based on the physical activity guidelines for Americans, you should recommend 150 minutes or more of moderate intensity exercise per week. Also, prescribe strengthening activities on 2 or more days a week that work all major muscle groups. And besides prescribing exercise, it's also important to prescribe activity for good health. It's critical to think of those many hours of non-exercise time during the day. Dr. Levine of the Mayo Clinic compares prolonged sitting to idling your car. Would you let your car idle all day long? No, it simply isn't good for it. And those of us who drive in the DC area know that. We know that regular movement, physical activity, increases circulation, burns more calories, reduces the risk of cardiovascular disease and diabetes, it improves mental health, and even reduces chronic pain. And studies show that prolonged sitting, the converse, increases the risk of blood clots, diabetes, heart disease, cancer, obesity, and even premature death. So it's critical to prescribe not only exercise, but also regular daily activity for good health. Tell your patients that a daily bout of exercise will not stave off the ill effects of sitting, so keep moving throughout the day. Recommend moving at least 10 minutes per every hour and walking about 10,000 steps per day, or approximately 5 miles. This may be hard to keep track of, but personal fitness devices or even your smartphone can help you track the steps. Also recommend to your patients using the stairs, taking walk breaks, and parking farther away. And if you're struggling to come up with ideas for recommending increased activity, the American College of Sports Medicine has a great brochure called Reducing Sedentary Behaviors, Sitting Less and Moving More, that you can give to your patients. You can print this brochure from the link on the T-Swift AIM form or from the URL that I've included in the training. Now, let's get back to injury prevention. This is the messaging we are providing to unit leaders, so we need MTFs to send the same messaging. When prescribing exercise, there are some key teaching points for injury prevention. First, prepare muscles and joints to perform. Get warmed up appropriately. Ease into any new workout, especially if you're not used to exercising. Don't do too much too soon. Eat right and sleep right for optimal recovery. And finally, prescribe a variety of exercise. Work on things such as strength, endurance, balance, agility, flexibility. Variety not only makes a workout fun, but it also decreases the likelihood of overuse injuries. Another key to preventing injuries is wearing appropriate protective equipment, such as mouth guards. So encourage mouth guard use for activities such as combatives and also contact sports. If soldiers or other beneficiaries do get injured, encourage immediate health care. We want to see soldiers right away so we can keep those problems from moving from acute to chronic. Soldiers experiencing injury should see a battalion medical provider right away. Earlier treatment means faster recovery. Treat acute strains and sprains immediately, and then refer to specialty care right away. Also, be on the lookout for signs of rhabdomyolysis. These lookout signs would be severe muscle soreness and brown-colored urine from muscle breakdown. Now, this sometimes occurs in soldiers new to extreme conditioning programs like CrossFit. Now, many soldiers do extreme conditioning programs, so it's good to have a working knowledge of programs like CrossFit and P90X. The Performance Triad advocates PRT, we support PRT, but extreme conditioning programs are, quite frankly, a part of the military culture. So if soldiers are doing these programs, we want them to do it safely. So providers, we want you to recommend the following. Develop base fitness first. Start out slowly. Do not work out to muscle failure, only muscle fatigue. Avoid the workout until you puke mentality. This plain is not good for you. Back off if experiencing pain or unusual soreness. And feel free to modify the exercise to prevent poor mechanics. For example, if you can't do pull-ups, substitute lat pulls. So, resources. What resources are out there for you and your patients? One new resource is Exercise is Medicine. The American College of Sports Medicine and the American Medical Association are making efforts to bring a greater focus on physical activity and exercise in healthcare settings. A button will soon be added in T-Swift that will link to the Exercise is Medicine prescription tool. This will allow diagnosis-specific exercise prescription and printing of patient handouts. Profiles. We're all very familiar with profiles. The bottom line is this. Use positive profiling as much as you can. Put alternate exercises on the profile that the soldier can perform. Try to avoid the proverbial dead man profile that results in soldiers going for a 30-minute stroll rather than doing physical training. If you're trying to save time, there are some standardized e-profiles you can use to save you keystrokes. The final resource is a screening and referral tools book. There's a link to the musculoskeletal screening and referral tools on the musculoskeletal up tab in the T-Swift AIM form. Screening and referral tools assist primary care providers with the early management of acute musculoskeletal pain and injuries. These tools should help to separate out serious medical conditions from common musculoskeletal conditions and injuries and provide steps to ensure early testing and referral for more serious conditions. For common injuries and conditions, the SRTs provide early management and referral guidance, which can help reduce the risk of progression to a chronic condition. If you haven't used them, go to the Quality Management Office website and download a copy. And if you haven't seen it before, this is what it looks like right here. So, where do you refer patients for specialty care? It depends on your MTF services, but here are some basic guidelines. If you have someone with poor fitness, desiring a fitness assessment and exercise prescription, you don't have to do this yourself. You can refer them to the Army Wellness Center. If you're seeing a patient with overuse symptoms that just aren't getting better with primary care, consider referring them to physical therapy, occupational therapy for the elbow, wrist, and hand, or to the chiropractor for spine problems. For acute strains and sprains, please send them to physical therapy or occupational therapy right away. We love to see the acute conditions to keep them from becoming chronic. Now, for more serious things like fractures, tendon ruptures, septic joints, and surgical candidates, these folks should be sent to orthopedics or podiatry. For hard neurological signs, such as drop foot or loss of a reflex, send them to neurology, physical medicine rehabilitation, or potentially physical therapy as indicated. Now, for chronic pain patients who just fail to get better with conservative management, including therapy, consider referring these patients to your local pain clinic or pain management teams. Now, I want to put in one last plug for Army Wellness Centers. Your local Army Wellness Center is a great resource for patients who are interested in adopting better health habits relating to activity, nutrition, or sleep. You just don't have time to change someone's health habits necessarily during a 20-minute primary care visit. So if you have a generally healthy patient who's interested in being healthier yet, send them to the Army Wellness Center for a health assessment review, which should be an analysis of their health status, risk for disease, and ability to increase their physical activity safely, or also for physical fitness testing. They use state-of-the-art equipment there to check physical fitness levels, assess and use them to create an individualized exercise prescription. If you want to direct a patient to an Army Wellness Center, enter an ALTA referral or direct the patient to walk-in. Now, to summarize the key activity points of the Triad. Prescribe exercise as medicine whenever appropriate. Also encourage activity throughout the day, 10,000 steps and moving 10 minutes of every hour for good health. We want you to promote injury avoidance recommendations, such as warming up and using caution with those extreme conditioning programs. And we want you to advocate early intervention for injuries. And also, find what motivates your patient to change. It's that internal drive that will make a difference. And finally, write positive profiles to allow continued safe activity with minimal loss of fitness. Now, before I finish, I want to briefly discuss the linkage between activity, nutrition, and sleep. I've really focused my piece on the importance of activity. Now, each performance triad component is independently important, but research shows strong correlations between activity, nutrition, and sleep. Implementing the performance triad is most effective when all three tenets are implemented together. For example, people who perform less leisure time activity are also likely to eat fewer vegetables, consume more soft drinks, eat more unhealthy snacks, weigh more and have more body fat, and have more difficulty sleeping. Looking at sleep, people who get less than 7 to 8 hours of sleep suffer from fatigue and are more likely to gain weight, eat more unhealthy snacks, those midnight snacks, have decreased stamina, and as one would expect, have decreased mental toughness. And finally, with respect to nutrition, people who eat more junk food are also likely to receive fewer nutrients, have decreased stamina, exhibit poor cognitive ability, suffer from increased fatigue, and have difficulty sleeping. Now, in closing, I just want to make one more point. Health care and treating primary complaints is important, and it always will be, because we're in the business of health care. But we need your assistance to nudge our patients in the direction of better activity, nutrition, sleep, and better health. Thank you.